Hi, I'm Hilma Volk from CarpalTunnelMaster.com, and I'm going to talk about what happens after carpal tunnel surgery. And where I get my information from is not from my first-hand experience, because I've never had the surgery, of course, but from surgical clinics who have posted on the website what their patients should do to recover from the surgery. Now, a lot of people are happy with their surgeries, but they kind of forget what they had to go through to recover from the operation itself. Just like I had a tendon injury while I was backpacking this spring, and it was really aggravated because it was 10 miles of walking on an injury that I could barely walk on for 10 more miles with a backpack. And it took me a month and a half at least before I could walk without pain or without a limp. And the things I had to do, the exercises, that's all behind me now. I don't think about it anymore. I'm perfectly fine now. But what happens right after surgery for carpal tunnel surgery? First of all, what they do is the carpal tunnel is made up of wrist bones like a ditch, and across that ditch in the front is a hard strap called the transverse carpal tunnel ligament. And what the surgeon does, whether it's open carpal tunnel surgery or endoscopic, is they slit that transverse carpal tunnel ligament. And what that does is provides more room in the carpal tunnel for things like the median nerve, which is what's causing the numbness in the hand. Now, when they do that, let me back up. What that strap is for, why you're born with it, is to provide leverage for gripping. So just about everybody, in fact everybody who has a surgery, has a weakened grip. Now, that grip can come back because what they hope for is that scar tissue will bring that transverse carpal tunnel ligament back together, which may gradually happen and it may take a year or whatever. But what can also happen is the scar tissue does not behave the way you expect it to or want it to. It can do anything at once, and it can go into the carpal tunnel area and create less space than there even was before, making the problem worse than it was before. Now, carpal tunnel surgery should always be a last resort. Unfortunately, some doctors will push it on with saying, well, you're going to get permanent nerve damage if you don't, and really freaks people out and they get the surgery. But a lot of what they think is alternative methods are really not cures for carpal tunnel. For example, some doctors will prescribe anti-inflammatory drugs first. Anti-inflammatory drugs have never, ever cured carpal tunnel syndrome. In fact, they interfere with the natural healing process and in the long run can actually make your problem worse. And there are definitely doctors who know this, but unfortunately there are other doctors who don't and prescribe the drugs and they will not help you. There's also night splints. Those can help you, make you sleep better without a lot of pain at night. The reason for the night splints is because when you're sleeping, your hand can flop around, and flopping like this can close the carpal tunnel area and, create more nerve problems, interfering with your sleep. But, so the splints are nice to help you sleep, but they're not curing anything. And a lot of surgical reports compare the surgery to the results for splints, and splints help you sleep, they're not a cure. Then there's cortisone shots, which do help, but they're short-lived. And when you need another shot, the problem is that they're very powerful, and most doctors will not give a cortisone shot in the same place more than twice because they're so powerful they can deteriorate tissue like tendons, ligaments, and even bone. And there's no reversing that at all. So surgery, like I said, should always be a last option, and unfortunately sometimes people are kind of pushed into it for one reason or another. But what happens during the surgery? For a lot of surgeries, especially the endoscopic, the surgeon might only spend 20 minutes, 30 minutes, and you're out of there. But the 20 or 30 minutes is not the magic bullet, because there's a lot of things you have to do to recover from the trauma of the surgery. For the first 2 days, your hand is bandaged, so you can't do much with that hand at all. And after you can take the bandage off, you want to keep that dry for at least 2 weeks with waterproof bandages if you're taking a shower. Otherwise, you keep it open. And any surgery, it doesn't matter what type of surgery, anytime you're invading the skin, there's a risk of infection. And that's any type of surgery. And although infection rates are fairly low with carpal tunnel surgery, they have happened. And that's why they say, you know, if you see any ooze or pus or green stuff coming out of your stitches, get right back to the doctor, you know, and nip that in the bud, because an infection can be extremely serious, can cause amputation, even death. So, but again, it's a low risk, but it's there. But what happens, you know, during the 2 days, actually, you want to be icing that scar area 20 minutes at a time. These things vary from what one clinic suggests to another clinic, what they suggest, but 15 to 20 minutes every hour for the first 2 days, and then after that, for the first 2 weeks, 20 minutes at a time, several times a day, you're icing that. Now, ice is a natural anti-inflammatory. It helps with the pain from the recovery of the surgery, and it also promotes healing. Now, any good athlete and any coach and any sports medicine doctor knows that ice is healing. And it's very strange to me that very few websites that talk about carpal tunnel even mention icing. When I was having problems with myself, doing long hours, doing massage way back, 19 years ago, now it's further along than that, since I've been retired from massage for several years now. But anyway, icing was the only thing that helped. The stretches that I read about didn't help, but icing did, including the icing of the forearm, because the forearm muscles control the wrist and fingers. But anyway, it amazes me how doctors and websites and stuff don't recommend icing, which if you did that much icing, for gosh sakes, you could prevent a lot of trouble. Now, you can do light duty stuff after a few days as your hand permits. You can do, comb your hair and dress yourself and that type of thing, and light duty things like typing, answering the phone. But you want to avoid any gripping, grasping, lifting. You don't want to do anything strenuous with your hand for 4 to 6 weeks at least. And after the second or third day, you start exercising. You do gentle exercises with your hands, and those are done several times a day, the ones that they give you. And in about 12 days, your suture comes out, and then you can start a little bit more exercises. In 10 to 12 days, the sutures are removed, and you want to keep that scar tissue soft. So they suggest massaging the scar tissue 5 minutes at a time, 5 times a day. Oh. Now, the third week, you're doing tendon glides and nerve glides. And the reason you do those is so you don't get scar tissue formed around your nerves and tendons. And the tendon glides, there's 5 positions. You do each one of them 5 times a day. And then the nerve glides, you want to hold each one for 10 seconds. There's 5 of those positions too, and you also want to do those 5 times a day. And then there's strengthening exercises that you start after the 3rd week, and you do those several times a day. The average cost of carpal tunnel surgery is between $7,000 and $14,000, probably on the lower side in most cases. But if there's complications, it can go up to $29,000. And the out-of-pocket cost is about $3,000 if you have insurance. Most people who get the surgery, if they're doing light-duty stuff like typing or whatever, are out of work for 2 weeks. But if they do heavier things, more industrial people are on the average out for 2 to 3 months. And sometimes it's 6 months. And some people never recover because of damage that was done during surgery, which is also fairly rare. Now, according to surgeons, the failure rate for carpal tunnel surgery is 9%. 9 out of 100. But that's not the whole picture, because what they say is that success is relieving the pressure on the median nerve so that the numbness is not there. And often that happens right away. People do feel that relief. However, the pain from the surgery can often exist for months and months, because the pain from the carpal tunnel ligament being traumatized, you feel the pain here. And you go to a doctor, 6 months later, I got pain here, and they'll say that's normal. Well, eventually that goes away too for most people, but also the grip strength. 57% of the people do not have their grip strength back in 5 years, and that's the number one complaint, is their grip strength. Now, my question is, wouldn't it be smart to avoid the surgery, avoid all those exercises that you have to do, and just do a few things, a few times a day, 2 or 3 times a day in fact, and get your hands back to normal without surgery? And that's what my program is about, Carpal Tunnel Master. Instead of spending all the time to appointments, and if there's complications, going back to physical therapy. And carpal tunnel surgery does not fix the nerve. It takes the pressure off the nerve. So if you can take the pressure off the nerve yourself, by self-help means, without any surgery, without anything invasive, without any risk, why not give it a try? I was a massage therapist for over 23 years. And for less than what I charge for one massage, you can look into my program. And I give guarantees. Money back guarantees. Will your doctor do that? Will your physical therapist do that? I don't think so.